Well, hello everyone. How are you this week? I know I didn't do a video last week, but last week I started to make a video and then it just my phone said it's full. So I spent most of the week trying to delete things and rearrange things so I can make another video. But this week, I think I'm going to talk more about what has happened this week. It's been a crazy week. Do you ever have one of those weeks where it's just like, what in the world? Well, started out really good, and then, yes. Anyhow, well, last week I had trouble with my phone to film. That was okay because we had a wonderful week. We got to visit with some friends, went out to eat with them, and haven't seen them in a long, long time. It was very nice getting to visit with them and talk about our children and how they're all grown and everything and all that. And well, most of them are grown. We still have one at home, but the rest of them are all grown. Well, then things started to change just a little. Okay, let me just go into detail about the week. So we had a really good night with our friends and things. Well, some of you know that I wear a catheter bag, and I had surgery a few years ago, well, about 5 now, where they insert the tube into my stomach directly in my abdomen straight into the bladder. Well, I tell you that because every month they have to take it out and put a new one in. Sounds painful, but it really isn't anymore. It's just part of life. Well, this is the awesome part. Here in Arkansas, they have home care come out, home nursing to take care of it. Back in Pennsylvania, I used to go to the urology clinic once a month and they took care of it and bam. Well, some of you know we live on base. So I thought I had to meet this guy at the gate. Well, at the visitor center. Well, he texted me Wednesday saying that he'd be there between 5 and 6 p.m. Well, I'm like, well, I won't be here. I'll be in church. So we need to reschedule. So we rescheduled for the next day. And I asked him what time it was going to be there and all that stuff. So I was at the visitor center waiting on him. And he seen me sitting there. And he could tell it was me because you could see some of my bag. And he said, "What are you doing here?" I'm like, "I'm here to meet you." He said, "What are you doing here? I can get on base without you." I'm like, "Oh, okay, well, I'm going to head back to the house then." Because I'm like, if I don't have to wait in line, I'm not going to. I'll see you in about 20 minutes, you know. Well, anyhow, about a half hour later, he gets here. In a little bit of trouble getting on base, but nothing major. So I had everything pretty much set up. And because, of course, you know, it's not my first rodeo. So had everything set up. And he came in and I said, "I'm sorry about the whole gate incident." He said, "No," he said, "you don't realize," he said, "after looking at your medical records, I thought you were practically a dead man." I'm like, "Oh, no, God's grace." And so I got to witness and we got to talk a little bit about God. So that was just awesome. So after all that, we got to church on Sunday and it was just awesome. Great messages, really felt nourished. Well, then there's today. And today is a day that I was tested. But let me back up a little bit. Friday, I had an appointment with hematology. They're the ones that do my chemotherapy. Okay. Well, so I met with him, talked to him, because y'all know if you're just tuning in, we have just moved to Arkansas a month ago. So we're still trying to get everything in our brain of everything going on. It's still a big whirlwind. But anyhow, we had that meeting. So the test came today. Well, here we go. You ready? Last night, I didn't have the medicine I needed to take. So I took something else. So when I woke up, I was more drowsy than normal. And we had storms coming through. So I hurried up and got ready. And I started driving to the hospital because I was having my first chemotherapy here. Well, I realized halfway that I didn't take my morning medicines. That's okay. I'll take care of it when I get home. Well, I was supposed to meet with what they call behavior health, and I canceled that because of the chemotherapy. And then I realized, oh, well, that medicine comes from them. So I need to get back in to see them. Well, so you see all the confusion that's going on, and it gets better yet. Well, I have been getting consult letters for doctor's appointments from Pennsylvania. They would be forwarded here, which didn't make a lot of sense to me. Well, I went to have my chemotherapy done, and I walked in, the nurse greeted me, and I sat down, and she started hooking up tubes to me, an IV, and she's, but I can't give you the medicine until the doctor comes and you sign the consent form. I thought, oh, okay. Well, about 10 minutes later, the doctor came over and he said, I need you to come over to the counter to sign the consent form. And he said, I'll push the IV thing and we'll walk over. And I'm like, oh, okay. And we started heading over and he said, you're probably so used to this. And I said, well, quite frankly, no, I've never had to do this before. So I signed off on the pad, and then I just casually took the IV cart and I walked back over and sat down. Well, the nurse came over and she went to hook up the medicine. And she said the chemo, and she said to me, she said, now that consent form is good for 1 year. I'm like, okay, because I never did any of that up in PA. I'm like, okay. Well, while I was doing that, Behavior Health called and wanted to reschedule. And I'm like, well, I'm glad you called because I need to get in because I need this medicine. Well, she said the lady would call me back later. And I'm thinking, I need this medicine. What am I going to do? So after I finished there with the chemotherapy, the nurse said to me, she said, well, they don't have any blood work scheduled for next time. I'm like, well, no, we only do that every other cycle, every other treatment. And I said, she didn't schedule me. There was no scheduling done, no nothing. And I thought that was kind of strange because usually they do that before I leave. I would have a set schedule when I was coming back up in PA. So I was okay. And I would get medicine, but all my medicine that I have been getting have been forwarded from Pennsylvania. So I'm thinking, okay, I need this medicine. So I'll just go to the pharmacy and get like an emergency supply, which they do if you need the medicine right away. Well, the one I was able to do that with, but the other one, they said no, they couldn't do it because I had a 90-day supply. And they did it on July 8th. And I'm thinking, a 90-day supply? I don't have no 90-day supply of that medicine. Quite frankly, I don't have any. And so I finally, I have walked all over this hospital. No one knew where this lady was that I was supposed to meet, this doctor, because the building was being renovated, the area that they were in, so they were all scattered all over. Finally, I did get to this lady. And by this point, I have had no medicine this morning, and I'm really feeling it by now because it's 1 o'clock in the afternoon. I've had chemo. I haven't had any medicine today yet. I haven't had anything to eat. And I was really starting to feel it. Well, I get into this doctor's office, and first thing she says to me, she says, well, you're not taking it right. You have a 90-day supply. Not the thing to say to me. I'm like, ma'am, I know I'm a little off, but I would know if I had a 90-day supply of medicine. That's 3 months. So we're going through and we're trying to figure all this out. And she ended up calling the pharmacy because I was able to get that one medicine that I need. And she said, I don't know how you got that. She said, because none of your medicine is active on this list. And I'm like, well, I take it every day. And she said, well, we need to find out what's going on. Well, it turns out what they did is they contacted the pharmacy in Pennsylvania, which gave them permission to fill that medicine. So everything started to make sense. I'll try to explain it the easy form. It turns out everything that I did has been coming from PA. Even though we transferred down here, and I've met with the original doctor to get everything started down here. Well, the problem is you have to physically call the VA to change your residential address. And I have to do them in both spots, in PA and here in Little Rock. Because as of now, I'm considered, if I was in Florida, I would be considered a snowbird. It's like I'm here visiting and I have to have all this done. So in order to stay healthy, it's stuff that needs to be done. So that is how it's all being done. It's all being said I can do it from the Pittsburgh VA because it's saying my residential address is in Pennsylvania. So, in other words, according to the VA here, I am just visiting and everything, my residential address is still in Pennsylvania. So that cleared everything up because that explains why I had to sign a consent form this morning because I'm not really registered here. I'm just a visitor. So I had to give them permission to give me the chemotherapy. Medicine. This is why my medicine is all messed up, because it's not in the system down here. It's all in Pennsylvania. So I spent over an hour with this doctor trying to rearrange medicine, get it on a list for down here. We had to build the list from scratch. So it was like a whole thing doing this. And we still have a 90-day supply of this medicine somewhere. No one knows where it's at. So we're trying to track it down. And there's a strong antibiotic I take when they do the catheter change. Well, it had to be approved by the pharmacy, and then they could send it to the house, and then I could use it, the day of the change. Well, I didn't get that either. And it turns out the pharmacy approved it, but it got stopped in Tennessee, in Memphis, Tennessee, at the the pharmacy distribution, because according to the records, I'm still in Pennsylvania, and I get my bag and all that changed at the clinic. They do home nursing down here, and since I'm just visiting, I really didn't need that antibiotics. We had to work to get that all changed. And the funny thing about all this is happening, and I'm in behavior health. They deal with the tumors, with anxiety and depression. It all depends on where the tumors are. It's a long story. So the lady has to ask me some questions. She's like, have you had any anxiety within the last couple of days? Okay. Do you see what's wrong with that picture? I have just spent an hour in this doctor's office trying to figure out where medicine's going, build a new list. Now I have to call 2 VAs tomorrow to make sure my residential address is here in Arkansas. And then I got to go start seeing all these doctors for real, as a real patient here. So, anxiety. Do I have any anxiety? But she was being for real, for serious. So I answered all these questions. And so then I had to go back down to the pharmacy, which is on the other side of the building, to get that medicine that I supposedly had 90-day supply of. So we got all that. Things are going well. I'm finally done with everything, and it's time to head home. Well, I get home. I take a little nap because, first I took my medicine, got something to eat, and then I laid down. Well, then I got up, and our daughter has been sick. So I went to go get medicine for her. It gets better. I get there. I drove out to the Dollar Tree, and I have never driven. Well, I have, but anyhow. It's a little bit tricky, but I got there, right? So I go in, find the cold medicine. I pick up 2 medicines that I think will be to treat the symptoms. I went to go pay for the medicine, and he had to put in the system that I was 18 because it would not register the medicine because of the acidophene or whatever that is in the medicine. So you have to be at least 18 to purchase the medicine. And the guy started laughing, and so did I. I'm like, isn't this something? You can go serve your country at 17. Your parents can sign off, and you can go serve in the Marines, Army, Navy, go, wherever, serving your country. But you can't buy cold medicine. You have to be 18 to buy cold medicine. Amazing. And we both started laughing. And then I came home and we ate dinner, and it's just been a relaxing evening after all that. I tell you all this because, some weeks it's just absolutely crazy, and you wouldn't believe it unless I told you. So, started out as a great week, and then bam, you get tested. So, but everything has worked out so far. I have some phone calls to make tomorrow. I have medicine that I need, and I only missed one day of them, so that I'm feeling kind of yucky in some ways, but that's okay. I have what I need. Everything's working out good from here on out. So, school-wise, I forgot to tell you all, I didn't pass that reading exam. Reading, writing. I took it again and I didn't pass it. So I got to do some more work for that. And I turned in my first math assignment. So pray that that goes okay. And I still have to take the math part of that basic skills test. So pray for me that I get through all that. I have 2 more semesters after this one, and I am done. So pray for me, we get through that. And other than that, everything's going great. It could be a lot worse. These are just little confusing things that have to be worked out. Who would have ever thought that I would have to physically call and tell them I have a new residential address, even though I have already out processed and in processed here. You still have to physically call and tell them that this is now my residential address. So this is permanent. Amazing. Just amazing. But that's okay. It all works out in the end. Even though today's been one of those test days, God is so good. And just remember that God is so good. No matter what your faith is, remember, for me, God is so good. And hopefully for you. Okay, well, that's this week. Hopefully next week will be better and we can get into some stories. But sometimes the week happens and you just have to go with the flow. So, okay, well, we'll talk to you later. Bye.